Somebody calls 911, they come for the patient. Now, can you walk us through that scenario? I mean, what's happening in the ambulance as they're driving to the hospital, and what is happening at the hospital in those 2 or 3 minutes? Uh,
Absolutely. So that's been an area that's been changing over the years, and it's a very exciting time for the stroke providers. Uh, in the past, you will present to the hospital, they will do the evaluation, you will be put in a room, and they will evaluate. Now, by the time EMS or emergency medical services arrive to your home and they evaluate the patient, they determine that there are symptoms of stroke, they communicate directly with us so that we start preparing. When you're going in the ambulance, we're communicating with the ambulance, preparing, mobilizing what we're going to be using in terms of resources so they can clear, for example, the CT scanner. An emergency doctor goes to the door, meets you at the entrance, obviously if they're available, but the whole team gets organized. It's a team of doctors, nurses, and so when the patient arrives to the emergency room, they get treated directly by the stroke team. They get taken directly to the CAT scanner. We do a CT scan if the patient is medically stable. We are able to determine whether it's a bleeding type or the ischemic stroke, and that when the patient goes back to the emergency room, we can give the appropriate treatment, whether it be lowering the blood pressure if it's a bleeding type of stroke, or providing a medication that can help break the clot. In many cases, the patients may require surgery, so we consult a neurosurgeon who gets involved. Sometimes the patients may develop severe respiratory distress and they need to be intubated. So that allows us to prepare and be ready to take care of the patient even before they arrive. So really the care of the stroke patient now begins before they even arrive to the hospital. And that's why it's important to call 911 and come to an ambulance.